administrator at the Eye Center. We're very excited that you've chosen us for your cataract surgery experience. I suspect that you've been developing a cataract for a while now, and your eye doctor has now told you that it's your opportunity for cataract surgery. We do see this as an opportunity because it's your chance to be free from contacts or glasses after surgery. Today, our goal is to walk you through what this process is going to look like when you come to our office, and also to talk to you about what's going to happen on the day of surgery. You'll also get to meet our surgeons. We know that cataract surgery can be scary, but we do want you to remember there are 4 million cataract surgeries performed each year in the U.S. alone. So just remember, we do this a lot, and allow us to guide you through this process.
My name is Dr. Patrick Risch. I'm originally from Muskogee, Oklahoma, so I grew up not too far away from here. I did my undergraduate University of Oklahoma, med school at University of Oklahoma, and then I trained in Memphis, Tennessee at the Hamilton Eye Institute. I'll often hear that I look very young, and I do appreciate those compliments. I know they're not going to last forever. But just to reassure you, to date, I've done over 8,000 cataract surgeries, and I'm very confident in my skills as a surgeon and confident that I can get you taken care of.
My name's Dr. Kevin Toller. I'm an ophthalmologist here at the Eye Center, certified by the American Board of Ophthalmology, and very happy to be giving you some information today on cataract surgery and some of the things we can offer.
Today in this video, we're going to discuss cataracts, common visual problems, the surgery process, and the options that you have for cataract surgery.
Cataract is a normal process. If we all live long enough, we're all going to have some cataract development. The lens of the eye, as we age, becomes more and more dense with proteins and protein deposits. That causes a cloudiness and a yellowing of the natural lens, which causes us to have some vision loss, or what we call dysfunctional vision.
Cataract surgery is just going in, gently breaking it up, taking it out, and then replacing it with a new clear artificial lens. And that new lens that we put in will stay with you and stay clear forever. There are a number of options for the lens that we put in at the time of surgery, and we'll talk about those in detail. Along with cataracts, there are some other common visual problems that we'll talk about.
You might have heard of nearsightedness or myopia. What that is the eyeball is actually too long. It causes patients to see up close, but they can't see very well far away.
The other common one is hyperopia, called farsightedness. Farsightedness means you're blurry and far, and also blurry at near, but worse at near.
Patients tend to see well at distance, but you still may need some glasses to see well at distance. The next thing that you may have heard of is something called astigmatism. What astigmatism is it means that the eyeball is not completely round. It's shaped more like a football than a basketball, and this football shape causes the eye to have 2 different types of prescriptions going in opposite directions, and that causes us to need glasses or contacts.
Another common visual problem is called presbyopia, and that happens to everybody eventually. It can be considered the first stage of a cataract. It's when our lens is still clear, but it loses its zoom-in power. The lens inside our eye gets slowly firmer.
Our lens doesn't focus as well as it used to, and we start to need some bifocals or magnifiers to do our reading.
So first, let's talk about the preoperative process. On the very first appointment that you come into our office, you're going to be greeted by a technician. That technician is going to take several measurements of your eyes. She's going to dilate your eyes, and she's also going to talk to you about your past medical history, what medications you're currently taking, and any goals that you have for cataract surgery.
We try and make it as efficient as possible, but it is a long visit. Please be patient. Please expect it to take some time. Let us know if you have any heart problems, any recent surgeries, any strokes, or recent heart stents placed. And those can be things that the surgery center wants to know about, so we don't have to cancel a case if we find out last minute. We want to be able to discuss what your goals are, what your expectations are for surgery, and how we can help meet those expectations.
Do you want to be free free from glasses and contacts after surgery for certain activities, or do you want to be free from glasses and contacts after surgery for all activities? That's completely up to you. Your doctor is going to make a recommendation when he comes into the room to greet you. He'll make a recommendation of what's best for your vision.
Each person has a very unique eye and a very unique visual system. You'll go through a series of tests. We'll do some measurements and some scans to get more information about your eyes and your unique position.
We'll discuss the different options that you have, the different advantages and disadvantages of those options, and the different cataract packages. We'll also talk about the risks and benefits of surgery. Fortunately for us, this is a very common and very successful surgery with a very low complication rate, and it wouldn't be such a high volume if it wasn't a really safe and effective surgery.
They'll escort you over to our surgery coordinator. She will talk to you about the recommendations that the doctor made that day. She'll answer any of your questions, and after you feel comfortable moving forward, we're going to try to schedule your surgery on the day you're here. It's probably going to happen 2 to 6 weeks after you're in our office, so take a look over the next 2 months, get familiar with your calendar, and decide when you would like to have surgery. About 95% of our patients go ahead and schedule their surgery while they're in our office.
We offer 3 packages. They're all going to fix the problem that brought you into our clinic. They're going to fix the cataract, but they're different in terms of the visual expectations coming out of them.
First is our bronze package, a basic level. This is what your insurance benefits will cover. This allows us to get rid of the cataract, which will make you see better, but it doesn't necessarily get rid of any of the other visual conditions. So you're still going to need glasses after this level of cataract surgery. If we move up to our silver package, this is an upgrade, so it's added a little cost for you, but we still get to take the insurance benefit of the bronze package. We're fixing the cataract, but the silver package, we're going to fix your astigmatism and your distance vision as well.
We will measure your eyes twice, measure the cornea and the retina. During surgery, we'll often take an extra measurement and figure out what power of the lens to place. We'll use a monofocal lens to address your astigmatism.
That's going to get you away from glasses for driving, for going to the movies, watching television, but you're still going to need some glasses to read with. You're going to need some glasses at the computer or your cell phone, but we're going to make it so you just can use some store-bought over-the-counter type magnifiers.
In that package, we include laser vision correction to enhance your vision if it's needed after surgery. Some people may not be a candidate for laser vision correction, but it's our way of committing to you. If you're trying to get out of glasses, we've got some extra options to enhance it later if we need. The third option is our gold package. This includes everything that's in the silver package, all the extra measurements, the extra time before surgery and during surgery, and it also includes lens technology that can correct astigmatism and presbyopia to enhance your range of vision as much as possible.
This is our highest level of technology and our highest level of benefit. There's going to be a few things where you're still going to want to pick up some magnifiers to see clearly, like grabbing that prescription bottle, but to do your everyday activities, grabbing a cell phone, navigating your remote control for your television, you're going to be able to do those things without glasses.
We actually perform surgery on each eye at a different time, so you will have a different surgery day for each eye. You're going to need a driver for each of those surgery days, so you might want to go ahead and talk to a close family member or friend to make sure that they're available to help you. You will not be able to drive the day of surgery, and at least for 24 hours afterward.
You're going to go to the surgery center. The nurses there will get you checked in. They'll start an IV, give you some medication to make you drowsy. Once we do that, we'll go back to the operating room and we'll begin the surgery. You can plan on spending approximately a couple hours there, but the procedure itself is relatively short, probably less than 10 minutes. Into the operating room, we're going to make a small incision, take the cataract out, and that's when we'll put in our artificial lens or our implant. After surgery, you can plan on some eye drops that you're going to be using for a couple of weeks. You're also going to need to have a few follow-up visits either here at the eye center or with your primary eye care doctor. We'll take care of arranging all of those appointments for you.
I really hope this video was helpful. We look forward to meeting you and finding out how best we can take care of your needs.
I look forward to meeting you, and I hope to talk more with you about your unique visual situation, the ways that we can help you.
Thank Thank you so much for watching today. That was a lot of material, so I'm going to give you a few reminders so that you feel prepared for your day of your cataract evaluation. Go ahead now and make a list of all the questions you have. You may have questions for your doctor or for your scheduler. Also, make sure you speak to a family member or friend so that you have someone available to drive you to each of your surgical appointments. You'll also need to look at your calendar. Make sure you're familiar with your next 2 to 6 weeks so that you have an idea of when you would like to have surgery. Remember, there will be a surgery date for each eye. And if you have any questions, you will have an opportunity to ask us at your appointment or afterward. Thank you again for watching.